Well, hello, everybody. Welcome to yet another edition of Special Education Thursday, which, as everyone who's a frequent listener knows, we don't always do on Thursdays. I'm still Maria Bloyer here at Advocates for Justice and Education, subbing for the effervescent Molly Whalen, who is away for a couple days. And I'm here with Dr. Valentin from Mary Center, and we're going to talk a little bit about the vaccine and kind of the importance of a medical home and continuity of care today. And I'm really excited. So Dr. Valentin, could you kind of tell me a little bit about who you are and what you do over at Mary Center?
Sure. Hi. Nice to meet everybody. Yes, my name is Dr. Valentin-Friebele. I'm a pediatrician at Mary Center. I primarily work out of the Georgia Avenue Petworth location, work in some of the other sites as well as needed during the pandemic. So you may, if you've seen me before, you've probably met me in one of the other clinics as well. And I've been there 4 years now. And I see all children, different ages, from infancy up until about 22, 23. And I'm very happy to be there and glad to meet you all and to be speaking with you.
Great, thank you. So I have a couple of questions that we've gotten here at the office about, about how families, should they still be going to the doctor right now, like for regular checkups and stuff? I know with the pandemic, it's, it feels like we're getting a lot of feedback about not going places.
Mm-hmm. Yeah, I think that's been, at first, I think it was very difficult. And we as a medical provider office, we weren't sure what to do at first either. But quickly it became, we're very aware very quickly that we needed to do well visits and continued care. Newborn babies are still being born. And so quickly, soon after the pandemic, we created this new system, and a lot of other offices are doing something similar, which is using telemedicine in addition to in-clinic visits. So a lot of times there are things that, you have a quick question for your doctor, you're just worried about this rash or this one thing that happened. You don't really feel like you have to bring them in, or you can't bring them in because it's too complicated with your work schedule and whatnot. So telemedicine and televideo or televoice visits are very common for us. And it's been really great. I think it helps a lot of people in the short term. In terms of your physical exams, yes, they are extremely important. It is very important to come in for your annual physicals. Again, sometimes what we do at Mary Center is we do like a half visit over the phone and then half a visit in person so that we can kind of discuss any urgent things and decide whether we need to see you sooner or we can hold off a little bit. Some of the things I want to stress as a pediatrician in terms of coming for your physicals, the importance, especially when they're younger. So obviously, when you're older, you're like 6, 7, early adolescence, you can come in once a year. You kind of know what's going on as a parent, whether there's something urgent. But when they're younger, also, it's important. Things like speech delays, problems with development, behavior issues, also like ADHD, is something that we're seeing a lot of. Of course, mental health is rolled in with that as well, like anxiety and depression, which children 7 years and upwards are experiencing a little bit more now than before. And that is something that we as pediatricians are there to help you with, something we can discuss and something we can address and actually link you in to behavioral health therapy and other things to help manage you during the pandemic so that, you're on top of those things and those things aren't being ignored while you're trying to figure out what the deal is with going to school. So those are things that are really important as a pediatrician that you need to keep in contact with us so that we can evaluate your child's development, because if they have a speech delay and it's already been delayed because of the pandemic, we don't want to wait anymore before we start things like speech therapy or physical therapy if it's necessary. So that's one thing. Also growth and development of, the physical body. During the pandemic, we've seen a lot of issues with obesity, adults as well, but children not being able to go outside as often for fear of the pandemic, fear of COVID, fear of crowds, all totally understandable. And we do have to be cautious, but we still have to go outside and do exercise. So weight gain has actually been a big problem that we've seen with our patient population. And that reflects, in terms of not just being overweight, but the risk of diabetes, vitamin deficiencies such as vitamin D, liver problems, all those things we're actually seeing a lot of because of this. So that's something to definitely check in with your pediatrician with and kind of see where your child is in regards to that. And then, of course, vaccines, which
Everybody
I
talks
think
about
we'll get
vaccines.
to.
Yes.
But so I can hold off and talk about that if you want. But that is definitely something that, when you go to your pediatrician's office, that's what we do, right? We give the shots. So children still need their vaccine.
Well, that's actually a really good question, because one of the things we have at AJE is a lot of families who have relationships with like specialists. Maybe, their child has severe asthma, or they've got a developmental issue and they see somebody else also.
Mhm.
But should those families also still make sure that they're checking in with their regular pediatrician as well?
Absolutely. Absolutely. Things like chronic problems, like you said, like asthma is one thing that sometimes, if a patient or child has asthma a long time, you just ran out of your albuterol, you kind of know what the deal is. You just need that prescription. Just call us. We'll help you. We'll get you through it. And yeah, definitely children who see other specialists still need their general pediatric visits, because some specialists are doing a lot of televisits, may not see the child in person. So we have the capability of doing that as well. And of course, we always try to be a go-between between the specialist and the family. And so we work closely with case managers and other insurance groups and things like that as well, to keep that coordination of care vibrant.
Okay. And I guess before we talk about vaccines, you
Mhm.
talked about coordination of care. Is that the medical home that families might hear a lot about? Is that
Yes.
where that coordination happens?
Yep. So basically, a lot of people may have a specialist at Children's Hospital, per se, and they talk to them often. They manage their care on a regular basis, but there's other things that they may say, just see your pediatrician. And so we can help coordinate that, and we can try to push things along and make sure you're on top of all the things that are necessary for school, that you have all your medication refills, that you need any referrals to see any other specialists. Like if you need to go to the eye doctor as well, you missed it during the pandemic, we'll do that referral for you. And so you have all those things that you need to stay on top of their care. And then again, like I said, we have people who will reach out to the specialists or case managers to get diaper prescriptions and things like that, and formula, special formulas that you may take, or special feeding needs that your child has. We do try to coordinate that as well.
Perfect. That's really helpful. So I guess now we can talk about vaccines.
Mhm.
And I know there's been a lot of talk about the COVID vaccine, and we're going to talk about that. But what about the regular vaccines? Are those still, I know there's been in the news some conversation about a lot of kids not having them right now. What should a parent do if they're worried they're behind on their vaccine schedule?
So I think that yes, that's definitely something we've seen. A lot of times, children typically get the majority of their vaccines in their infancy, so when they're 1 year
Mm,
or less in age. So that's kind of the multiple vaccine visits. So a lot of times we've seen children who have missed several months of coming to the doctor, and we understand it's been difficult, but we're there for you, and we are more than happy to catch you up to date on your vaccines. We'll work with you. Sometimes it can seem overwhelming, but most pediatricians will just say this is what they need, and we can do it in this amount of time and this many visits, and catch you up so that they're not so far behind once they do return to school or get to school or daycare, that they are fully vaccinated. And for older children, a lot of times we have children who come from other countries and they are behind on their vaccines. And so they're kind of used to the idea of multiple vaccines at one time, which is kind of what we're having to do with a lot of the older kids than we did before. But again, we'll work with you. We'll explain it to you. A lot of the schools will also provide kind of a list of what they need. We'll double check it and cross check it and see if they in fact need that. We do not try to vaccinate if we don't have to. Multiple times. But yeah, so the people still need them. People are still traveling, coming in from other countries where some illnesses are still pretty predominant, more than they are in the United States. And we are going to be hopefully going back into some large group environments. So the threat of getting those illnesses, permeating around us, it will return.
okay. And the COVID vaccine, what I know right now, it's everybody 12 and up, right?
Mhm. Yep.
So is that something that they can get at the regular doctor, depending on where they are, or Can they do it at the same time as they have other vaccines? What should parents be thinking about?
Yeah, that's a great question. So they just recently did approve 12 years and older to get the Pfizer vaccine. At Mary Center, we are providing it for well visits. So if you come for your physical that was scheduled a couple months before and you're of age, we'll give you the COVID vaccine at the same time as you can get your HPV vaccine. For example, a lot of 12-year-olds need the HPV vaccine, their second dose, or the first one if they missed the first one. And that was a question that we had at first as pediatricians, but it's been determined that it is more than safe to be able to give those vaccines at the same time as the COVID vaccine. If you have any questions about the vaccine, we are going to tell you about it first. Nobody's going to surprise you and just vaccinate your child without you knowing. It's a discussion that we can have and explain in detail at that moment with your pediatrician about the safety of the vaccine if you still have questions.
Perfect. Well, thank you. Those were all the questions I had, and this was actually really helpful for me because my son is scheduled to get his second
Oh,
HPV on the same day that he gets his second COVID shot. So I'm
okay.
super excited. So that was handy. Um, that's all the questions I had. Thank you a whole lot for coming and chatting with us. I guess my last thing is, where should families go if they have more questions? I feel like the answer is always talk to your pediatrician, right?
It is always talk to your pediatrician, at least in my book. So yeah, I definitely would do that, and reach out to your schools. I think school nursing offices and departments and heads of school are also very well informed and have connections. So I think just reach out to whoever you have. If you're not sure, just start asking the questions. Somebody probably knows someone who can get you in touch, and you can always call Mary Center and just schedule a televoice appointment with one of the doctors if you're not even sure where to start. We can definitely start a conversation and just figure out what the next steps will be.
Great. Well, thank you so much. I
My
appreciate it.
pleasure.